Did you know that your postpartum recovery can be significantly eased with the right support team? That fluoride in your water might not be the hero you've been led to believe, and that medication doses aren't one size fits all. Grab a tasty beverage and your notepad. Let's discover together.
The Discovery Doc Podcast, where your journey to empowered, non-toxic living begins. Join me, Dr. CeCe, a doctor of nursing practice, self-proclaimed toxin tamer, and mama of four, alongside
Me, Annah Kate, your medical mystery overachiever. Together, we'll uncover the latest in functional medicine, debunk health myths, tame toxins, and provide practical tips for thriving in a modern world.
Get ready to take control of your health with expert insights, raw stories, and actionable wellness strategies designed to help you and your family lead vibrant, toxin-free lives.
Let's discover together.
So let's rewind a little bit. So in season 1, if you go back and listen to those episodes or watch those episodes, you can see CeCe going through cholestasis. So, and there are several, and you might not be able to tell, but under she's doing this. Oh, she's doing this like but under the camera. So we have something that you created called the cholestasis guide, and you put together a whole pregnancy and postpartum guide of all the things, having all the checklists and all of that. So if you're pregnant or you know somebody that's pregnant, get them that resource. It's a great resource to have. But you did this by firsthand experience, and you reversed your cholestasis or slowed it down.
Yeah, no, did reverse it. So I think this is great to talk about now too, because there are just.
How was your cholestasis?
It was cholestasis was all right. I mean, mine was okay. I had a little bit of itching here and there, but nothing.
He had sympathy itching. Oh my god!
And sympathy itching. I did. I really did.
Yeah.
Like, oddly, it wasn't like I'm dying. But
he was trying to. So
refresh our memory out what cholestasis is. Yeah, those of us that are not medical professionals.
So cholestasis is basically when the bile builds up. You produce bile by your gallbladder, and it's supposed to be broken down in different places of your body. But in pregnancy, sometimes women don't have the ability to break down that bile, and so it's made from the gallbladder, and it builds up in your blood, and there's no real way to get it out. And so the only symptom outside of sometimes a little bit of jaundice is true intense itching. And this itching, it comes from the inside out. It's your blood. So it's not topical. You can't put on antihistamines. You can't put on creams. It has nothing to do with your skin. So nothing topical works. It is completely from the inside. And I had it with Ava and Jackson. Ava came on about 37 weeks, and then I had her at 38 weeks. Jackson, it came on earlier at 35 weeks, and they induced me at 37 weeks. Jada, I completely avoided it. So at Jada, I was so fearful to get pregnant again that I created my own protocol, which is that guide. And I did that from day one of getting pregnant with Jada, and completely avoided pregnancy-induced cholestasis, which apparently is impossible or not possible to do.
Yeah, we did it. You did.
We did it. Mm. Then fast forward with Jace, and I got a little lazy. I'm not gonna lie.
You had a lot going on.
I had a lot going on, and I did not take my own protocol. It's something that I should have done from the get-go, but I didn't. And I would take things kind of sporadically here and there, but not consistently. And so then around 30 weeks, we had a intense, I contributed to stress. I do in October. We had a pretty stressful October where some things happened in our personal life. And literally a couple days later, I just woke up with intense itching.
Yeah.
And so I was like, man, that is stress. And I hadn't taken anything. I wasn't doing anything to prevent it, like a doofus. But that then switched my gears into, okay, I know how to prevent it. I just didn't listen to myself. So now how do I reverse it? And part of reversing it was implementing the protocol I created initially, but it had to be a little bit more extreme. Like now my numbers were already elevated. It was severe. My entire body was bruised. Like
it's like you're playing catch up and not
get
off.
Exactly.
Or trying to catch up with.
Exactly. I put in the reel on Instagram for the cholestasis guide, I put up pictures of what I looked like in pregnancy, and y'all couldn't see it here because I would cover it, but I had bruises all on my butt, my legs, my calves, my arms, my chest from itching so bad.
And scratching so hard.
Yes. And it was 2 weeks of pure hell. I mean, we were sitting in the middle of the bathroom, because he was up with me every single night. And he would just like hold my arms down. And we would be praying. He put oatmeal on me.
Oatmeal.
God, it was nasty. Oatmeal on me.
Didn't work at all.
It didn't work at all. Like anything.
Yeah, I think we had to run oatmeal too.
Well,
All
it's
the
not
tight stone.
internal.
Yeah.
So outside things aren't going to help.
Oh, but just something. Ice packs. I mean, everything.
The foot beds.
Yeah.
Sauna.
Everything. And finally, after, I mean, it was so, there was nights where I'm just walking around itching myself crazy, wondering like how the hell am I gonna get to the next day.
Yeah.
It was really, really bad. But within 2 weeks, my levels started coming down. Thank God. And I remember just being like, one of the last nights being in the bathtub, being like, please God, just take this. Please just take this. Please just take it.
Mm-hmm.
But with everything that we started and implemented, I was able to reverse it and over. So it took about 2 weeks for my levels to start going down. And then 2 weeks later, they were completely zero. So by about 34 weeks, they were completely normal. Liver enzymes were normal. Everything looked great. And there was a big kind of what if of, are we going to be able to have a home birth? Do we set up for a home birth? Do we have a hospital birth? Like I was getting monitored by another midwife just in case I needed to go to the hospital. And we were just like, we went back and forth about it for a while.
Yeah, I mean, we had everything set up to home birth and everything worked out, or to the hospital and do it that way.
So I'm like a mind diet. I was like, I want to set it up if I can't do it. And then, but finally, when those numbers went down, they were both like, hey, we're doing this. Like, we're going to commit to this.
Yeah.
This is what's going to happen, God willing. And fast forward, little man came on his own at 38 weeks. And the cholestasis didn't come back. So yeah, we beat it one pregnancy, reversed it a second pregnancy.
So this is a tried and true protocol that actually works. And the doctor tested it. So this is not something that she may have
I actually tested it on reversing it.
Admittedly, the doctor also needs to follow her own instructions.
So I would suggest to just do the protocol from the get-go and not do what I did, because it was 2 weeks of, I mean, I know, that's almost like probably the hardest 2 weeks I've ever been through. But this guy was there with me every single night, and then he had to get up with the kids. And I mean, there was days where I would be doing virtual patients in the office, and I had no clothes on. Like I would be on phone calls because I couldn't have anything touch my skin. And Heidi would walk in, bless your soul, Heidi, and just like laugh at me and then give me some ice or try to give me like an IV to try to help anything at all. But I wore slippers throughout winter in Georgia. I wore slippers every single day out in kids' outings, New Year's Eve, everything. Because it's the only thing I could tolerate. It was wild.
It was tough. It was like, I think that was the worst case that we've had.
Proves what stress can do to your body.
Yeah, and it was instant.
Yeah, we were very focused. Like from the get-go, I was like, nothing is going to stress me out. Yeah. I'm very focused on keeping my stress down, keeping my emotions regulated.
Yeah.
And
well, you went through a tough season when you were pregnant with Jada.
Yeah, right. That
was a big shift for you.
That was, yeah. The end was tough. But I feel like I'd already kind of implemented the correct things where it didn't impact me. Like it did with him. But yeah, and then we had him at home at 38 weeks. He came really fast. You're like
fastest baby we had.
Yeah, like 2.5 hours.
8.something pounds.
8.4 pounds.
I wanna take time to encourage and edify Will, because Will is the perfect partner for CeCe. Like they are I mean, you'll only get to see them when we bring them on or in their individual things, but I kind of get a front row seat to how they do family and all of that. And he is just whatever it takes, whatever the family needs. Will it is squarely on his shoulders. So he carries a lot of the family aspects and burdens. It also has his dreams and his things that he wants to do, and they make it all work. And so I want to just, if you were seeing
I appreciate it.
It's true.
I don't like to be seen though. I don't like to play in the background. I'm just I just credit it to my upbringing. Like, my upbringing was very much kind of chaotic, to put the best wording on it. It was chaotic, so you had to figure out how to adapt to chaos a lot of the times and be there mentally, emotionally, and be able to like coordinate and set a direction for yourself a lot of the time. So now that, you know, becoming a father, becoming a husband, that was always on my bucket list of things I wanted to do. So,
but it's also like the support aspect. I see a lot of patients who the women want to do one thing, but the men aren't supportive of that. So like there's a lot of moms who want to have a home birth and they're like, well, my husband would never let me. And so I have this husband who's like, all right, babe, like I trust you. Like, let's do this. We're in it together.
yeah, I mean, there are worries, and I talked to her about it. And I'm like, hey, man, like this is different, especially with our first one. It's like, you want to have a home birth? Like, what if this goes wrong and this goes wrong and this and that, all this stuff? And I think being able to communicate my concerns and saying them out loud really helped. And really, for me, it's just like, yo, this is what you want to do, and I'm going to do it. There's not a lot of control I have. I'm just going to be here and make sure that when my kid gets here, I'll just do the best job I can as a husband and a father. So.
And that's something that was invaluable this pregnancy, was just the support for trusting my own body.
Mm-hmm.
Like, he was there to support me, although nothing worked. Just trying to support me and just being more comfortable and being awake with me at night. Like, he didn't once just leave because he needed to get sleep to be up with the kids. There was one, and I was mad, but okay. But he really needed sleep. Okay.
Yeah.
One night out of that entire month.
It was building up.
Yeah.
And it was like,
but otherwise, he was there every night with me. Like, even though I was shutting down all of the offers that he was suggesting that I knew they wouldn't work, he was still trying and being there with me. And then my midwife, Debbie Schneider, she was right there with me too, and being like, CeCe, I trust you. I trust your instincts. I trust your intuition. I trust that you know what you're doing. I trust your body. And so if it weren't for them, I don't think it would have ended up having him at home.
Yeah.
You know, there's a lot of women who would have been pigeonholed into saying, hey, well, this is happening and there's nothing I can do, so go get induced. And even, the kicker is I was getting monitored by a perinatologist just as extra precaution because of the cholestasis, even though by the time I went to the perinatologist, it had already been reversed, just to check in on him and confirm developmentally he was all good. So I was happy with that with the ultrasound. But even though my numbers were reversed and I brought my last 3 weeks of labs to prove that it had been reversed for a while, they still said, no, you need to be induced at 37 weeks. And I said, but what? So you're saying I don't have cholestasis right now. I had it for a month and now it's reversed and my labs have been clear for 3 weeks. And you're saying that tomorrow I need to be induced instead of just letting the student come naturally? And they're like, yeah, that's our protocol. And I said, so for all women, no matter what, if they have 1 day of cholestasis, you're suggesting that they need to be induced at 37 weeks. And he said, yeah. I said, no, thank you.
Which is why we have the conversations that we have and we have the platform that we have, is to help empower and educate you to know that if you reverse cholestasis, that you still have options, that you don't have to go by the rules of lawyers, because the reason they do that is because they have a board of lawyers.
Yes, and he told me that. That's the one thing I enjoyed about him.
He was kind of like,
he was honest. He
came back in honesty.
Yeah.
And he was like not trying to put himself in any danger, just worst case scenario, which is understandable. But he was also very if it was me type of deal, or maybe kind of.
He basically said, they sit down and they say, okay, what is the liability on our end? So as a blanket, women are to be induced at 37 weeks. We don't take it by an individual basis. We don't treat women as unique humans, and it's for our own liability. And he actually said that to me. And I was like, I appreciate that. I appreciate that honesty. I disagree with it, but I appreciate the honesty. And so I did agree to go back every week until he was there, which ended up only being 1 more week, to just have the non-stress test. Yeah, I'm sure he was all good, because I'm good with that. Make sure his heart rate's good, whatever. But I thought that was just conventional medicine in a nutshell.
Yeah, pretty much sums up. That tracks.
Yeah, I think that's kind of how it always goes. And I think that's kind of our good balance, is that I'm very much, my wife is very much, this is what I see, and this is how we're going to operate, and this is what it is. I'm very much like, all right, this is what it is, but what could it be? Like, what else could we do, and where can we go from here? And it may not always make sense, but I'm always going to be in the spot where it's like, all right, well, this is not an ideal situation, but, you know, we could just keep chopping at it and just keep throwing stuff at the wall until something sticks and just go that route. But that was like, I think that was one of the things that got us through this one, especially. It was like, is at that point she was so far gone that everything we were doing that was working, she was so discouraged by everything. It was just like, well, I'm just not going to do anything. It was like, well, something's working. We just got to keep going and do everything. We're not sure what it is. And then finally we figured out the combinations.
And I think also I had already been put in a mindset, like when we had our 20-week anatomy scan, when you have a home birth, you go and do an anatomy scan by some other doctor that's like unrelated to your birth. And the tech gave us a comment about something that she saw on the scan that was never something that a tech should say ever. And she didn't know what I do for a living. So she made a comment about his brain not being developed like it should. So Will was filming the whole thing. I went back and actually looked through the ultrasound because she then just left that nugget. She said, if the doctor is saying what I'm seeing, then they'll want you to come back because I'm seeing something not right with his brain.
This is why you're a tech and not a doctor.
Can you imagine like leaving that little nugget with a new
Why?
Right. And so I was like, I mean, and you're pregnant and emotional, all these things. So Will had been recording the screen the whole time. So my psycho self, I went back that night and went through the entire recording to find exactly what she was talking about. Yeah. Because harshly, I'm not an ultrasound tech, but I could find what she was talking about. And so then that sent me in the spiral because it was a little off. Turned out he's just fine, but it's like people just want to put fear in you.
No.
And like I had already been in that place at the 20-week mark, then like having all these what ifs based on this part of the brain structure that was off. And then you start cholestasis and it just, yeah, it was a rough pregnancy.
And these are like the times where like, I think I thrive the most. Yeah, is because when I see it, I'm just like, oh, let's go.
It's like, I'm burning it all down.
And I just, you know, I go after it. I'm like, you know, it's unfortunate that the technician made that decision, but, you know, I'm very open with my wife and just tell her, look, she's a technician, not a doctor. And just, we have to be understanding that, you know, she clearly wants to be something more. And hopefully she gets to that point in her career. But at this point, that's not her job and responsibility. So we're just going to move forward. And again, I'm just very like tunnel vision when it comes to like my family and my wife and my kids. So anything that happens on the outside really doesn't really matter too much to me. So yeah, we just figure it out. And I think we did a great job. Like, even though we were way far behind and needed to play catch up. Yeah. I think my intensity as far as like positivity and just kind of pushing forward and figuring it out really kind of thrived during that time.
I agree. And in our birth video, like when he comes out and he's on my chest, that look, I mean, I watched the video like 100 times, but it was such a sheer look of like relief and release that like, that was insane. That was just amazing to be able to have him at home and he'd be perfect and healthy. And just after going through all of that, I mean, your appreciation really, it puts everything in perspective.
We are so glad that you are here. We're so glad you don't have cholestasis anymore. So all the fun things.
I think you should maybe, I don't know, like maybe point out that like even after birth, you still need to continue profile,
100%.
Everything is completely in the clear.
Look at that. Well, so yeah,
noticed.
Yeah, when so after birth, so it's interesting. I think that it might after birth, my body kind of just needed to recover, and so I'm trying to have a sip of wine. Like 2 weeks after, and I broke out in hives, and I was like, "Oh, my liver is not happy with me." Even though my enzymes and everything had gone back to normal, and I kept checking them every week. The post just after having them, like the inflammatory response still needed to calm down. Yeah. So I do suggest continuing that protocol to its fullest, like at least 6 weeks postpartum. to just help your liver recover. The liver is awesome. It regenerates itself. So it's really good at healing, but just to give that extra support, at least 6 weeks.
Yeah.
Yeah.
Welcome to this segment of Discovery Doc Deep Dives, where we are going to go into the postpartum care and after delivery and all the things that happened with this little squeaker right here.
Look at his hand right here.
Raising his hand.
Yes,
You have a
guys,
question, sir?
he was born with laryngomalacia, which is a little floppy airway, and it's cleared up for the most part. But when he gets tired or sleeping, these are his little sounds. So we love them, and we don't apologize for them.
No. So enjoy the background noise.
Exactly.
Yeah. So let's go into postpartum.
Yes.
So when we had a guest on, and we talked about pregnancy and postpartum and home birth and all of that stuff. And one of her suggestions was, and Margolis, was for you to take care of baby and for everyone else to take care of you.
Yeah.
How did that go?
Okay, so this was probably the best postpartum period I've ever had. And it took a team, though. It really did, because when we had Jace, it was January 29th, the end of January. So the kids, we do homeschool hybrid, but they still have school 2 days a week where they go. They still have their homeschool work to get done. So Will had to take over. We also decided to get 2 puppies in October. So we had 2 3-month-old puppies, okay?
Flotsam and Jetsam.
Yeah.
That's not their names.
That's not Blue and Blaze, but close. And so we had 2 puppies, plus our older dog, plus 3 children that had pre-K and or in their homeschool. That he jumped right into taking over all of that. I mean, he already, you know from these episodes by now that he cooks all meals, so that didn't change. But we had Jace at my mom's house, and we do live right next door, but it was going back and forth, getting clothes back and forth, getting backpacks, feeding the dogs, going to let the dogs out, that he jumped into taking care of everything else. And then he still had to go to work. And so he would take care of me by taking care of all of that, where I was able to sit in downstairs in this bedroom, which is next. It's where my grandpa used to live. So there's a bedroom with a little kitchenette next to it. So I didn't have to go up and downstairs. I had what I needed right there. But it was like mine and Jace's little cubby hole. Like we just hung out down there. The kids would come back from school and come hang out with us. But as soon as I looked like I was getting overstimulated, Will would go take them home, take them outside. My mom would take them upstairs. That it was kind of in little spurts for the first couple weeks. And then I was really craving chocolate milkshakes for the first 2 weeks postpartum. So Will, every night coming home from work, he would stop and get me a chocolate milkshake and bring it back. I know.
He's a good hubby.
Yes, he is. So that really, really helped me on that side. Is he was very protective of my space by taking all those other variables out so I could have my space, and then bringing me food when I wanted food. The other part of it was I had a postpartum doula. Her name is Sam Martin. And she was magical. I mean, she was there 3 times a week for the first couple weeks postpartum. She did body work on me. She did a womb massage. She did belly wrapping or belly binding, so it helps to bring just your abdomen back together. We did vaginal steaming, so we would just sit there. She would make me this beautiful, warm, rich morning drink that was healthy, had ghee in it.
Yum.
And it just all these cacao and some coconut milk or raw milk, just amazing. And I would sit there and we would just talk. And she had just had a baby actually about 7 weeks before I did. So she'd bring her little nugget, but we would just talk, and just to have that connection to somebody who was there to take care of you, but also could connect with you on a personal mom level was so invaluable, because there's things that men will never understand, like the hormone changes. And my husband is very, very understanding, and it's not his fault. I'm not saying he should understand, but just having that other person there who knows exactly how I'd be feeling was so validating. And then she would leave food for me for the week. So on days she wasn't there, I could just go, and Will would always bring food, and we stocked up the kitchen. But it was all warm and rich, and having that postpartum instead of cold foods really helped me to heal a lot more. And all her food had a purpose. So she is very Ayurvedic in terms of her approach to postpartum care. And so I would go and just, go to the kitchenette and heat up some food when she wasn't there and have that. But that was doing your squeakies are a little loud, okay? I love them, but everyone listening might not. So I had her for 20 visits postpartum, where again, the first couple weeks it was more often. It was 3 times a week, and then it would go to 2 times a week, and then once a week. But that was life-changing. And then just the support around that, like there's an awesome lactation consultant that I had. Her name's Annah Duncan. And she came to my house within the first week and sat with me for an hour. And just because every kid's different and positioning's different, and like I can know all the things, but then when I have my own kid and I'm tired postpartum, like I want someone to just tell me what to do.
You're not supposed to be the doctor.
Yeah. And so she just came and took care of me, being able to feel confident in my breastfeeding journey. And so I just felt so much more prepared and taken care of this time. And I wish that every woman got to feel that instead of just like alone and cold and like going right into honestly mommy housework mode.
Yeah.
Like that's part of the reason I loved having Jada and Jason, my moms, was because it prevented me from getting up and going to clean, going to do the dishes, taking the dogs out, cleaning the dogs, like doing things, because none of it was there. None of it was an option. So yeah, it was amazing. It was definitely one of the best. I would say with having 4 kids, I definitely stayed in the more overstimulated zone for a lot longer than I have in the past, where I couldn't handle the grocery store I didn't step in the grocery store for probably 4 months. I'm not kidding. Yeah. Like just the hustle and bustle of it and the noise. Like I was very overstimulated.
And the lights.
And the lights, like everything. Yeah. So that part of postpartum was a little bit different, but the actual healing part of it was amazing. And even now I feel like he's 7 months, and I feel like I'm just now starting to be able to balance life a little bit more, because after getting out of that overstimulated phase, like I went back to work when he was 8 weeks old. And I really had to force myself like into those conversations with patients. But I also started very slow. Like I started half a day and then kind of worked up, where I think by 3, he was 3 months old when I started a full schedule, and I was still like, that's all I could handle in a day. Yeah. And I came home and just held him, fed him, and that was it. Yeah. I just feel like now I'm finally able to like really do other things and enjoy them and not just do them because I have to. Mm-hmm. So that part's taking a little bit longer postpartum this time around, but it's just because there's more. Yeah, there's more. And the actual healing journey was, I mean, so good.
Good. Well, we're glad to give you that space to allow you to do what you needed to do and have the full support of not only Will, but also Heidi running the clinic and your practice.
And can we give Annah Kate a shout out here, because she literally kept the podcast going for 7 months now, because I couldn't handle it. Like, this is the first time that we have sat down to record, because it has taken me this long to feel like I had the bandwidth and the space and the time to give my energy to this. And I thought, a couple months ago I could. Initially, I thought a long time ago that I could, and I was just like, I can't do it. Like, I don't have it. I can't do it. And then I put another date on it, and then that date came, and I was like, I still can't do it. And I really, like, in these situations, I have to prioritize my practice because those are patients right in front of me. But AK has been over here busting her little booty, keeping this thing going, and being so understanding of my journey and so non-judgmental of it, and the time that I need, and the fact that at the end of the day, I will always... I want to prioritize my kids. And sometimes that needs to happen instead of us being able to meet or record. And she's always so just understanding of that. So yeah, I would not, like her, Heidi at my medical practice kept things down while I was on maternity leave. Being the only provider in a medical practice and going on maternity leave is not the most ideal situation, but she held it down at work. And then my actual husband, it was a team effort. It was nothing that I did. It was everything that everyone around me did.
So we hope and pray that is your postpartum journey as well, is that you have a team around you and have a system in place. And we'll talk next week about some guides that she's put together of firsthand experience and the things. So we'll tap into that next episode. Yep. But if you're in the postpartum place, just ask for support, slow down. Yes. Get the nourishment that you need and just take care of baby.
That you deserve.
Yeah, that's all. That's your job, is to take care of baby, and it's everybody else's job to take care of you. So.
100%.
Okay, back to taming the toxin that everyone knows as fluoride.
Yes. So for decades, fluoride has been added to our city water, and on the understanding or belief that it will prevent tooth decay, right? That's what we think.
Yeah, that's what we've been told.
What we've been told. However,
Big water.
big water. However, numerous studies have been performed that tell us the risks about consuming fluoride. So not just applying it topically to the teeth, but actually consuming it, and that the consequences of consuming it outweigh the potential benefits, especially for sensitive individuals such as, hey, babies who get formula and water. Okay, can we just pause and say, what does drinking water have to do with your teeth? Like, what if we're drinking through a straw? It's not touching your teeth. You're swallowing it. So what the heck does that have to do with preventing tooth decay?
I went out to eat yesterday, and this kid was drinking out of a straw, and he was like totally Shamu. You know how Shamu rolls his tongue?
Yeah.
He was doing that with his tongue. Yeah.
So
you're drinking. Yeah, you're Shamuing and drinking it through. He's rolling his tongue, sticking the straw in, and drinking that way. I'm like, that's genius.
It's genius, but also then what are the benefits here? Yeah, fluoride in our water if we are Shamuing the water in general. Anyways, the Journal of Neurotoxicology found evidence that fluoride accumulates in the human body and creates motor-like dysfunction and learning disabilities. Okay, we're just going to put that little nugget there. Other connections have been made with fluoridated water and lower IQs, thyroid abnormalities, arthritis, Down syndrome, and by 2004, about 500 peer-reviewed scientific studies had appeared indicating the health problems associated with fluoride consumption. Yes.
Who thought this was a good idea?
We're going to get to that in our myth-busting section. You guys can imagine. But those other health problems included weakened bones, muscles, ligaments, plus nervous system dysfunction and cardiovascular dysfunction. So,
yeah, this should not be a thing.
No, it shouldn't be a thing. So what can we do about figuring out what to do about that thing?
Yes, Dr. CeCe, what can we do?
Listen to the next episode.
All right. Stay tuned. We're going to toxin tame this toxin a little bit more in our next episode. We'll see you then.
On this segment of Medical Myth Busting, one medication dose fits all. True or false?
Merp. False again. We're doing a lot of falsies this month.
Yeah.
But yeah, this one is false, but we're going to tell you why.
Lots of people believe it's true. So
a lot of people think it's true, which is valid because I don't think these things are talked about. So most doctors, they will give you a prescription that's super generalized for adults. Now, I think it's better for kids, honestly, because for kids, it's based on weight. So think about this for a second. And this is completely not where I was going to go.
Just like with your pets.
Yes. So when kids are little, let's say something is 5 milligrams per kilogram. We are doing that math. Anytime I'm writing a prescription, I'm doing that math uniquely to that child based on their weight and then dividing it either in, twice a day, 3 times a day, whatever it is.
Metric system.
Yes. As soon as we hit adulthood, that goes out the window, even though we can have a woman that is 120 pounds and then a woman who is 200 pounds or a man who is 150 pounds or a man who's 350 pounds. Like, we don't consider variables in adults. So there are certain guidelines, again, weight for kids usually, duration, frequency, route, but not everyone works the same. So like we said, just for weight, other factors are genetics, metabolism. How do we detox these synthetic drugs? How do we detox things in general? Our environments. Everything is very, very different. And we don't take the time to understand that in conventional medicine.
In the name of medicine, before you break my heart. Okay, so why do we need to address this? Why is this so important?
Okay, because if in conventional medicine, if something's not working right, the answer is just to increase the dose. Okay, so we put on a medication, let's say for anxiety. We try to start at a lower dose. If it's not working right, we just increase the dose. If the patient experiences a side effect, the answer is to prescribe another drug to mask a side effect of the first medication. According to the AMA, or American Medical Association, individual variation in how we absorb and metabolize any prescription drug or synthetic chemical can range from 400 to 4,000% difference.
That's a big range.
Yes, in the dosage required between one person or another. Do you think doctors are out here taking that into consideration every time they write a script for Prozac?
No.
No, absolutely not. The one size fits all is a marketing myth. And again, going back to what we were talking about with commercials, like that marketing it does make it a myth. It makes it look good, like it will be good for you. It'll be good for your neighbor, be good for anybody in that entire family because they're all in the commercial. Physicians, most doctors want maximum effectiveness, which leads to a higher dose and overprescription. So kind of an example like that Prozac, the starting dosage is 20 milligrams. And in a study conducted by the Journal of Clinical Psychiatry, 85% of Prozac users suffered from diarrhea, 70% profuse sweating, 50% gained weight, all because that starting dose was too high for them. But it doesn't change the fact that the starting dose is 20 milligrams for everybody. Another one, antibiotics. About 90% of sore throats in America are viral in nature, meaning antibiotics won't do anything. But medical statistics indicate that 73% of about 6.7 million visits by adults to physicians complaining of sore throat end in a prescription for antibiotics, even though it's not even warranted in that sense. And other variables and other factors are taken into consideration. So
why isn't that discussed? That antibiotics don't help with viral things. They only help with bacterial things.
I mean, that should be common knowledge, and it's not. And I get it. Some doctors are out here saying, hey, well, the patient is they're wanting it. They're demanding it. I'm sorry. Is it their license? Are they prescribing it, or are you? You know?
We get a baby.
Yeah, come on.
We get a baby.
We get a baby. Come here, dudes. Hi, welcome back, my lovely.
Hi.
Welcome back.
Missed you.
We missed you. And we have a little snorted. Back in action. So all that to say.
So an antibiotic for you versus an antibiotic for him cannot start at that 20 milligram dose.
No, but like for him, we would do it per kilogram. We do it by weight. For me, it would just be given, and it's overprescribed for. Okay. Oh, bye. I know you're tired. You're tired. It's okay. And it's overprescribed for viral issues when it should never be in the first place. Now, all that to say is drugs are not unique to you. Your factors are very different from you to the next, in terms of your methylation, in terms of, again, your genetics, your ability to detox things. And there are really cool genetic tests that can be done that can tell you how you're able to absorb certain drugs or anesthesia. That's why there's so many different issues with patients with anesthesia. Some people wake up in it. Some people need, how we metabolize it is different. And so, I remember as a kid, when I had my first knee surgery, I woke up in the middle of it, and the doctor, the anesthesiologist, was like, wow, I had to give you the same dose of anesthesia as a 40-year-old man. And I didn't understand what that meant back then, but it's because I process it too quickly.
Yeah.
I metabolize it very quickly. So if that's a really great just example, and if that's being done with general anesthesia, then it's being done with drugs or medications that I might need also. Yeah. So it just is something that is not taken into consideration, and therefore one specific dose of a drug does not fit all sizes. Right. Usually the answer is just to increase the dosage, which may never work for that patient because their genes won't allow them to utilize that synthetic chemical.
Crazy. So what about, so we all turn and learn. We look at the back of packages and it says take 2 every 4 to 6 hours or 8 hours or 12 hours and don't exceed don't exceed 6 or whatever it is. So how,
too much milkies.
Take a breath. There you go. So how do we know on that end too of and we need to do a myth bust on ibuprofen and all of that.
We do.
The side effects of what happens.
That's a great question. And My answer is that it really shouldn't be on the patient. Like, it should be, medicine should be so individual that we get to know the patient to the best of our abilities before something's prescribed. Now, I understand that that's not, that can't be done in acute situations, right? Things have to be given in the ER, things have to be given. But if something's not working, if the patient isn't responding, then our answer needs to change and understand why the patient is not responding. Is it because they genetically cannot metabolize this drug? Is it because they metabolize drugs really slow or really fast? There should just be more individualized care there. And I feel that's on our job. That's a part of our responsibility, not the patient. I don't think as a patient there's much else you can do besides getting certain genetic tests done that show you drugs that you're able to metabolize or not. I think that's really powerful information. If you are someone who is consistently needing medications or anesthesia, that is something that you can take action from, or then go back to your doctor and say, hey, I've done this genetic testing. It shows that I cannot process this. What else can I take? Right, dude?
Are you full? Are you full now? Yeah. Oh, you see something shiny, something pink. You silly boy. So that's all great information to know about. Hey, not one size doesn't fit all, and two, that there are things that you can do about it. So you can get this metabolic testing.
Yep.
And you can try. Good thing I washed that this morning.
Not that I would care anyway.
No. God made dirt. Dirt don't hurt.
Exactly. Yeah, there are things that can be done, but I do put the responsibility of that mostly on the provider. So if y'all have myths that you want busted, you send them our way. We're happy to do the research with it, for it, on it, whatever the proper word is, and get that out there, whether it's fact or fiction. We are here to discuss it, open conversations. Mm-hmm. We ain't scared of none.
No.
Until next time,
let's discover together. Remember, flourishing in postpartum recovery, making informed decisions about fluoride, and ensuring your medications are tailored to your needs are all achievable with the right information and support. So surround yourself with a reliable team, stay informed, and always trust your instincts. We'd love to see you around. So become an insider at thediscoverydoc.com to gain exclusive access to bonus content, helpful resources, and the latest updates. Also, leave a review wherever you listen to podcasts. Your support helps others discover our show and join our wellness-driven community. Explore more resources at thediscoverydoc.com, your one-stop destination for practical tips, expert advice, and inspiring stories on achieving optimal health. And follow us on all the social media platforms at The Discovery Doc for daily wellness wisdom and engaging updates. Thank you for joining us on this journey towards a happier, healthier you. Stay curious, stay informed, and we'll see you next time. Hold your horses. Before we ride off into the sunset, let's take a moment for a friendly disclaimer. The information shared on this podcast is for general, informational, and entertainment purposes only. While we strive to provide accurate and helpful information, we're not here to replace your trusty healthcare provider or doctor. Consider us your Discovery Doc trailblazers, sharing our knowledge and experiences as we journey forward towards wellness. However, remember to always consult with a qualified medical professional before taking any action based on the content of this episode. Like the Wild West adventure, this disclaimer may change occasionally, so be sure to check back for updates. Stay healthy, stay adventurous, and keep blazing trails with the Discovery Doc.